Hello, my name is Bryant Hansen. I'm a physician assistant at Grand Peaks Medical, and today I wanted to talk briefly about fever in children and how to manage that and when do you need to come to the clinic and seek treatment. One of the most common phone calls that we get in our clinic are parents who are worried about their child because they think they might have a fever and they don't know exactly what to do. Do they give them medication? Do they need to bring them into the clinic? And so we're going to be addressing some of those common concerns today. The first thing I wanted to talk about is, first of all, how do you check a temperature in a child, and what are the different types of thermometers out there, because certainly there are ones that are more reliable than others. First and foremost, if you have a baby who is 3 months of age and younger, the preferred method of checking their temperature is with a rectal thermometer, okay? And so that's just a regular digital thermometer, but instead of placing it in their mouth, you actually insert it into their rectum, just about a half of an inch or so, and get their temperature in that way. A true fever in a baby that age can be a serious thing and will likely need a workup, and so it's very important that first of all we're using the correct method in order to see if they really do have a fever or not. And so 3 months of age and younger, a rectal temperature is the preferred method. Another very common thermometer is what's called a temporal artery thermometer. Where we're in the midst of a pandemic, a lot of us are getting our temperatures checked pretty regularly, and this is one that I have seen used a lot. And so that is a thermometer that is either swiped across the forehead like this to check the temperature, or also through infrared where it's just pointed at the forehead like that to get the temperature in that way. That is less reliable in children, especially 3 months of age and younger, but in older children it's an acceptable form of checking. Another really common thermometer is called a tympanic thermometer. That is one that's placed in the ear to check in that way. That is one that we use at Grand Peaks very commonly in older children, 6 months of age and older. It's considered a good and reliable thermometer. In children that are 4 years of age and older, the preferred method is an oral temperature, an oral thermometer. So that's placed under the tongue with a closed mouth to get the temperature in that way. And that's just a regular digital thermometer as well. For parents who have babies that are needing rectal temperatures, and you also have older children that need oral temperatures, make sure you have 2 different thermometers and you're labeling them correctly so that you're not mixing up a rectal temperature gauge or a rectal thermometer and an oral thermometer. Other thermometers that are out there that are considered unreliable methods, using a digital thermometer and just placing it under the armpit, that really is not very reliable. And also there's these newer pacifier thermometers that have not been proven to be very accurate, and so we prefer that you do not use those ones. The next really big thing that I wanted to talk about is what actually defines a fever. So there's this magical number that we use in medicine of 100.4 degrees Fahrenheit and above. Any temperature less than that is not considered a fever. People's temperature will go up and down for various different reasons, and perhaps you could run kind of a little higher temperature than you normally would, but we don't consider it medically significant or medically concerning unless the temperature is 100.4 and above. And also keeping in mind that that needs to be with a reliable and good thermometer. Another important thing is to remember that a fever itself is not necessarily a bad thing for children. That's part of the immune response fighting off an infection most of the time. And so the fever is not really the enemy, it's what's causing the fever that we need to worry about. So let's just say you have a 6-month-old that feels a little bit warm, and so you check their temperature and they have a fever of 101.5. The next question is, what do you do? The first thing is you want to make sure that you're trying to find the source of the infection. In most parents who have a little bit of experience, it's pretty obvious most of the time where or why a child has a fever. A huge majority of the time, kids will have a fever because of an upper respiratory infection, meaning they have an infection somewhere between the sinuses here and then down to the lungs here. And so common signs and symptoms of that would be like a runny nose or congestion, or they may be pulling at their ears, acting a little bit more fussy, those types of things. Teething is also a very common cause of a fever in younger children. And so if they're drooling a lot, if they're gnawing on their knuckles or on their fingers, that could be a sign of teething. And sometimes you can even feel in there and feel that their gums are a little bit swollen, or you can feel the tooth wanting to start to come out. Having recent immunizations is also a very common cause of having a little low-grade fever. If you cannot find the source of the fever, if you check their temperature and it's above 100.4, but you can't figure out why they have a fever, that's when you need to call the office, because we might need to do a little bit more of a thorough exam and maybe even a little bit of a workup in that way. So if your child does have a fever, making sure you use the right thermometer, the right method of use, the temperature is 100.4 and above, and you find an obvious source that is not serious, then you can think about how do I manage that at home on my own. The first simple thing to do is you can remove extra layers of clothing. I think as parents sometimes we have the tendency, especially in younger babies, to overdress our kids, hoping that they don't get cold, but sometimes that can actually overheat their bodies. And so if they have excess layers of clothing, make sure that you dress them appropriately for the environment that they're in. And lots of times that'll bring down the temperature just doing that. Also, taking a cool bath, not a cold bath, but just kind of a lukewarm or a cool bath will also help bring down that fever on its own. Certainly there are also fever reducer medications, the most common one being acetaminophen or Tylenol. That's a medication that's safe and good to use in kids of all ages. Also ibuprofen or Motrin would be the other name for that, is also very good and effective to use. We discourage that you use ibuprofen in children 6 months of age or younger because that particular medication is metabolized through the kidneys, and children's kidneys are not fully developed until they hit that 6 months of age. If they have a persistent fever, it is also okay to alternate those medications. So starting with Tylenol and then waiting 3 or 4 hours, and if they still have a low-grade fever, then you can go ahead and put the ibuprofen on, and then alternating with Tylenol after that, and so on. The other really important thing, and this is a very common misconception that parents have sometimes, is making sure that you dose those medications correctly according to their weight. We have a chart that shows what would be the appropriate dose of medication for both Tylenol and ibuprofen for your child, depending on what their weight is. Also, when you go to the pharmacy and buy those medications, the labels on the medicines will usually have a chart inside, so make sure that you're dosing those correctly. Reasons that you would want to call the office and consult with a nurse over the phone, or where they could advise you to even come into the office for evaluation. Infants who are 6 months or younger that have a rectal temperature of 100.4 or above, they need evaluation. We need to figure out what's going on, especially in newborns that are 3 months of age and younger. A fever could potentially be a very serious thing, so they need to be evaluated. A child who has a fever that lasts for more than 5 days. Most upper respiratory infections are caused by a virus and will usually resolve on its own before 5 days. If it's persisting longer than that, then there's a chance something else could be going on, such as a bacterial infection that would need prescription medication for that. Another reason is if your child's temperature is 104 or greater. That could be a more serious infection and may need further evaluation, and so that is a reason when to call the office. Another reason is if the fever reducers, such as Tylenol and ibuprofen, are not helping with the fever. So making sure that you're dosing correctly, obviously, and even alternating for a few hours, and if it's still not coming down, then please give our office a call. Another reason is if your child is acting very sick. They just don't look well, they're acting lethargic, they're not eating or drinking well, and if they're starting to show signs of dehydration, then that can be a concern, and that's when you need to call the office. So in babies, if they're having less than 4 diapers, or in older children, if they're not urinating every 8 to 12 hours, that would be an early sign of dehydration, and they may need to be evaluated in that way. Also, like I had previously mentioned, if you cannot find the source of the fever, then you need to call the office. You may need to be seen. And also, if a parent is concerned, if they just have kind of that parental intuition that something might be going on, I just need extra advice, or I need a doctor to take a look at it, we're more than happy to address any of those concerns. So I hope that was helpful. I hope that answered a lot of common questions that especially new parents may have with their babies. Please do not hesitate to visit our website or to give our office a call if you have any further concerns. Thank you.